All right. So as I mentioned, this webinar is brought to you by the San Francisco LGBTQ Dementia Care Project. And some of you may have attended some of our trainings in the past. Some of you might not be so familiar. So I always like to level set just so we all can get on the same page, or maybe have a refresher for sort of the basics of Alzheimer's and dementia. So one of the most common questions we get is, what is the difference between Alzheimer's disease and dementia? So dementia is an umbrella term for loss of memory, cognitive abilities, and other thinking, and it's severe enough to interfere with daily life. And Alzheimer's disease is the most common cause of dementia, making up approximately 60 to 80% of dementia symptoms. Vascular dementia, dementia with Lewy bodies, and frontotemporal are also common. And another concern for the LGBTQ community is HIV-associated neurocognitive disorder, or HAND. So we actually did a webinar last year in June where we heard from a doctor at UCSF who's an expert in HAND. And we learned a lot about how HIV-associated dementia is actually quite rare, especially since the advancements in treatments over a number of decades. HIV treatments are highly effective and effective at keeping HIV viral loads undetectable. So we learned a lot about how HIV dementia is actually quite rare, but there might be some cognitive changes that people might want to work with their doctor on as they age. So we actually are going to do another presentation on HIV and brain health again in June this year. So look out for that. And we know that age is the greatest risk factor for Alzheimer's disease, and an estimated 2.7 million LGBTQ people are over the age of 50 are aging. And we know that our community has greater health disparities, many of which are also risk factors for dementia. We know that 7.4% of the lesbian, gay, and bisexual older adult population is living with dementia. And our community has specific needs and concerns, specifically around accessing care. Many of our LGBTQ elders and older adults lived through a time that was much more homophobic, much more transphobic, and therefore may have experienced more rejection from biological family. They may report that their support networks have become smaller over time, and they may, 34% live alone. We know that many of our LGBTQ community fear discrimination from health providers. So that's a big reason why our project exists here, is to build capacity for health providers and health professionals in San Francisco to be able to really provide quality, gender affirming, and non-judgmental care to our entire LGBTQ community. So a little bit more about our trainings. We have an LGBTQ cultural humility training, and we also have an effective communication, better practices for dementia care training as well. So if you haven't attended one of these trainings and you're interested, you can reach out to me or visit the QR code here. And just a little bit about the partners on this project and resources you can reach out to. And with that, I would like to stop sharing my screen, and we're very excited today to have a community partner from the San Francisco AIDS Foundation with us today, who's going to share a little bit about a needs assessment that was conducted in San Francisco for trans and gender nonconforming people over 50. And so Jam Chen, a program coordinator at San Francisco AIDS Foundation, is going to share a bit about their findings. So thank you so much. Take it away, Jam.
Thank you, Katya. It's good to be here. My name is Jam. I use they, them pronouns. And like Katya said, I'm from San Francisco AIDS Foundation in the Aging Services Department. I'm going to share a little bit about a needs assessment that we did for the greater part of 2022. This was a collaboration between 3 different organizations: SF AIDS Foundation, SF Community Health Centers Trans Thrive, as well as Gender Health SF. And this arose out of ongoing dialogue between community members and service providers about the needs of aging, trans, and gender nonconforming community members, as well as the role of service providers in creating a continuum of care that meets people at all stages of aging, transition, and more. Situating this in the context of joint transphobia and ageism impacting this community. So there are ongoing needs for TG&C folks at every age, such as general safety, from transphobia, needs for stable housing, and there are also emerging needs that are specific to this generation. So what does geriatric care look like for TG&C folks? How does disability and different access needs play a role as people are getting older and illness and disability plays a role? What are the compounding impacts of COVID and MPOX and such on increased isolation for this generation? So the goal is to ensure that we're providing a continuum of culturally competent services for this community. And also just want to say aging is something that is relevant at every stage of life. We're in a political moment where our country is setting records for proposed legislation that is anti-trans, such as denying youth gender-affirming healthcare, drag bans, and more. And I think this is important not only in terms of servicing and resourcing a generation of trans elders that's been fighting this fight for many decades, but also creating a world that young TG&C people can see a future in. So with that, I'm going to start sharing my screen. And share a little bit more about the needs assessment itself. So this is the background, which I just gave a brief overview of. The needs assessment timeline, let me minimize this. Okay. So in December of 2021, we had a kickoff holiday brunch where we brought together different community members and shared a little bit about what we're doing, as well as just provided an opportunity for people to celebrate the holidays together, be in relationship community with one another. In March and April of 2022, we conducted 3 community conversations with community members. There were 2 done in English and 1 done in Spanish. We worked closely with Ella para Trans Latinas to develop the agenda, the questions, as well as the survey. And then we also had Karen Aguilar, who will be on the panel later, from Gender Health SF, who was our facilitator for the Spanish language community conversation. In May, we circulated among different community partners for additional survey responses. In August and September, we did kind of an iterative analysis process where we looked at the data and drafted findings and then shared back with service providers and community members so they could take a look at what we came up with and ask questions to deepen our analysis, as well as respond and share if this was in alignment with what they were experiencing. November, we had our final report published. And then in March of this year, we're doing a community report back with the final report, inviting TG&C 50+ community members, including everyone who participated in the survey and or community conversation, as well as are getting the report translated in Spanish and published. And then in April of 2023, we're going to begin exploring further gaps. Something I'll talk about in the demographics a little bit is that out of 43 participants, only 1 person identifies as transmasculine. So that's a big limitation with who this report can speak to. For methods, we did 3 community conversations with 20 participants total, really valuing qualitative as well as narrative-based information about experiences, in addition to the 43 total survey responses, which were more quantitative. We did an iterative analysis, which is what I mentioned about sharing draft findings, having people respond, and then going back to the data, revisiting it with all of this feedback in mind. For the demographics, we had 43 participants total. There was limited respondents from folks on the transmasculine spectrum. So 76% identified as trans women. 46% are Latina, and 40% completed the survey in Spanish, many of them monolingual Spanish speakers. 30% disclosed positive HIV status, 47% are receiving some form of public assistance. And then the most frequently reported zip codes of residents included Soma, the Tenderloin, and the Mission. So at a high level, before diving into the themes a little further, the key findings are TG&C and culturally competent care providers are needed to address, complex aging and healthcare needs. There's a lack of stable, safe, deeply affordable housing for TG&C people ages 50 plus in San Francisco. And this includes proximity to community and services. Inclusive and supportive community spaces are vital to counter isolation. I'll go more into this later, but in the community conversations, people talked at length about the different support groups, as well as opportunities for community connection that were really antidotes to the isolation that they're experiencing. And then community members desire collaboration and coordination from service providers. So this was also talked at length about in the community conversations, is just a need for greater coordination and collaboration between the different organizations, as well as leveraging the collective political capital that's present among all of the different TG&C as well as LGBTQ organizations in San Francisco. I'm going to go into the key findings. So for health and mental health, how you read this graph is we asked the participants in this list of problems, rate if they were a major problem, a minor problem, not a problem, or don't know in the past year. So there were problems listed like physical health, performing activities of daily living, etc. You can see them on the y-axis of this graph. And then they're color-coded according to the percentage of respondents reporting major problem, minor problem, not a problem, or don't know. I grouped major problem, minor problem together and organized these in descending order. So you'll see that physical health had the greatest combination of people reporting it to be a major or a minor problem. And in the community conversations, to kind of supplement this quantitative data with more of the narrative story behind what people are experiencing, people talked about a lot of barriers to care access. A lot of them talked about post-op challenges and accessing preventative care, doctors not knowing how to navigate their anatomy when it comes to preventive care or what to recommend in terms of preventive care screenings. Speaking to just a need and urgency around trans competent care providers, not only with transition related care, but also in preventive care, in aging care, geriatric care, etc. And then to kind of complement that, a lot of people also talked about needing health education and their own tools to advocate for their own health needs. And yeah, so there are kind of two parts to that, with the cultural competency needed among care providers, and then also just equipping people with their own tools to advocate for their healthcare needs. It's important to note that the 50 plus age category is a diverse age category. We didn't have as many respondents who were in the 70 plus category. The majority of them were, I think it was around half a split, with people in the 50 to 59 category and then 60 to 69 category. And you can see that people who reported physical health as a greater problem tended to skew as a greater problem for the upper age range of 70 plus. And then going into mental health, the very top listed combined major and minor problem was mental health, as well as feeling lonely, sad, and isolated. In general, aging prevents a lot of different challenges for isolation, especially if people have family estrangement, if they're low income, have mobility issues related to disability, physical or mental illness, a limited support network. These are all challenges that the 50 plus community experiences in general, and maybe compounding as these things affect LGBTQ elders in general, as well as TG&C folks over the age of 50. As well as for this group, the experience of compounded stigma, as well as internalized trans ageism. And then I think it's important to note that there is community members talked about just like needing to heal from the immense amount of grief that this generation has faced. So for this generation of trans and gender nonconforming people, for a lot of them, it's the second pandemic of their lifetime. Many have lived through the height of the AIDS epidemic, 30% disclosed positive HIV status. And with COVID, there's been a lot of re-traumatizing parallels of government inaction, high mortality rates, isolation, stigma, and barriers to care access specifically for transgender nonconforming people. So that plays a role as well, and has compounded in the past few years living through this ongoing pandemic. In the community conversations, many people talked about individual therapy as a really important container for them to talk through their different mental health challenges on a very individualized basis, as well as highlighted the importance of community spaces and the need for inclusive community spaces as a reason to not be in isolation, as a reason to leave the house and connect with other people. Another category I'm going to talk about is safety. So specific threats to safety were not discussed at length during the community conversations. That doesn't mean that they aren't present. It just wasn't something that arose as heavily during discussion. Around 55% of people said that safety overall was a major or minor problem. And then looking at some disaggregated data by race, the percentage of Black respondents who listed safety as a major problem was almost double the percentage for the overall population, which is really significant and important, and also unsurprising given the joint effects of transphobia, anti-Blackness, racism, ageism, as well as the higher rates of violence that Black trans feminine people experience. There were some subcategory safety issues, such as physical harassment, sexual harassment, experiences with law enforcement, and pretty consistently, the Black trans respondents ranked them as higher issue areas compared to other racial groups. For housing was the highest percent reported as a major problem. So just looking at disaggregated just the major problem, not necessarily major and minor combined. People talked about experiencing transphobia in housing searches from landlords, which is also unsurprising. People also talked about just like the limited options accessible to them. They mentioned trans people often being relegated to SROs in the Tenderloin. And I think this is important when we look also at the different services utilized. So like SF Community Health Center, Openhouse, SF AIDS Foundation, St. James, all of those were like very highly noted organizations in terms of services that people are accessing. And a lot of them are concentrated in the zip codes where people are living as well. And so something to consider in the different like housing that should be available is considering agency as well as proximity to community and organizational resources that community members are accessing in this whole conversation about affordable, accessible housing for trans people over the age of 50. Different mobility and accessibility needs also increasingly become a concern as we factor in illness and disability in the housing needs of this generation. To talk about community a little bit, we asked a question on the survey that said, what is a place that feels supporting and accepting of you in all of your identities, in all of your intersectional identities as a trans 50+ person? Many people listed support groups as well as CBOs such as St. James, Ella Para Trans Latinas. People talked about trans life and BBE at SF AIDS Foundation. And on the other side of that, 14% of all respondents said they could not name a single place that felt completely accepting of them in their wholeness, which I think is a really jarring statistic when thinking about the role isolation plays, especially in old age for trans folks. People talked about the helpfulness of support groups, and they talked about different challenges such as interpersonal dynamics, body negativity, a sense of comparison between people, as well as a need overall for more inclusive spaces that include people of different races, people of different gender identities along the trans gender nonconforming umbrella and spectrum, as well as also talked about a desire for intergenerational connection. Many people talked about feeling disconnected to younger TGNC folks, and wanting to play kind of a mentorship as well as bidirectional learning role in relationship with trans youth, learning about the fights that they're fighting, the ways they're organizing for community members as well, because a lot of them are feeling the ruptures across generations within transgender nonconforming community. For organizational needs, here's a quote from one of the community conversations that said, "We need some dialogue between the 24 or so organizations to discuss discrepancies, areas of focus, and how to better serve the community." This was a major theme that people talked at length about in all the community conversations I sat in on, in that when there's more cohesion between the different organizations, community members benefit and everyone benefits. A lot of them talked about like challenges with witnessing, competition for resources, and, just desiring greater collaboration and cohesion between the organizations, also to leverage like political advocacy on the front in interfacing with legislators and decision makers, leveraging the kind of capital to advocate for resources and things to better meet the needs for trans 50+ folks in San Francisco. For recommendations, people talked about needing competent providers to address holistic health needs for an aging TGNC community, as well as hiring TGNC providers directly who have lived experience. People also emphasized this on the front of mental health providers. And then especially as disability and illness are natural parts of aging, this community will need greater access to care, beyond like transition related healthcare. They will need geriatric care, long-term care, et cetera. And it's important for all providers, not just gender health providers, to be gender competent in being able to meet these care needs of this aging population. Amplifying TGNC 50+ voices in housing justice campaigns. So many of the people, the community members talked about their top service priorities as affordable housing and financial support for rent and utilities. The majority of our responders are renters, which was 77%, or living in a hotel, 11%, experiencing many challenges with their housing search, experiencing landlord discrimination, as well as substandard conditions in their units and needing to wait a long time to get things fixed. And then in the conversation about housing, considering different accessibility and disability needs. Building inclusive community spaces for TGNC 50+ people, speaking to a need for a caring, supportive culture in groups, as well as combating like ageism, racism, internalized trans misogyny that can sometimes be present in the interpersonal dynamics of group spaces. 27% of the respondents listed intergenerational connection as a top priority as well. So like I mentioned earlier, really feeling the ruptures across generations and desiring connection with TGNC youth as well. Desiring organizational collaboration from different service providers, as well as transparency and accountability among these different providers and the things that they are providing for TGNC 50+ folks. And then building educational programming for TGNC 50+ people. So again, talking about the role of, yes, service providers, but also in the meantime, as we are building a cultural competency among all providers, building education and tools so that community members can advocate for themselves and be equipped with the knowledge they need to, advocate for their own health needs. And specifically highlighting like aging needs, preventative care, especially post-op. And to share a little bit about next steps. So we're having a community lunch and share back for TGNC 50+ community members specifically. That'll be next Friday, March 17th from 11:30 a.m. to 1:30 p.m. It'll be at SF Community Health Center Trans Thrives new space at 1460 Pine Street. So if you know any community members who might be interested in coming and learning, as well as just sharing space with other community members, feel free to contact me, and I'd love to invite them. In terms of next steps that we've undertaken since completing this needs assessment, one major thing we're doing in the upcoming months is exploring gaps with transmasculine aging needs. We're going to be working with a transmasculine consultant who has lived experience, as well as experience facilitating community groups with transmasculine folks over the age of 50 who will be undertaking those next steps with us. We also have been working with Karen Aguilar of Gender Health SF to start a support group for monolingual Spanish-speaking trans Latino women, as well as undertaking more collaborations with Openhouse, SF Community Health Centers, Trans Thrive to do monthly TGI lunches and dinners, as well as are starting in the planning stages for a creative expression group for TGI folks over the age of 50. I'm going to pause there. That's the end of the report that I've prepared. I'd be happy to take any questions in the chat, or if you want to come off mute and raise your hand. Yeah, I'd love to hear the questions and reflections from you all.
Thank you so much, Jam. That was such a rich presentation, very informative, and thank you for providing a lot of recommendations and next steps as well. It's great we have 62 health providers in San Francisco here on the Zoom with us right now. So thank you. And we do have one question I see in the chat. It says, Jam, thank you so much for the info. Not sure if I missed it. Was this project specifically for trans and gender nonconforming folks, or LGBTQ plus in general? And then a side note to that question, 76% trans women, was the 24% not answered or cisgendered?
Thanks for the question. So this was specifically for trans and gender nonconforming folks. 76% were trans women. The others were either gender nonconforming, declined to respond, and then 2%, aka one person, identified as a trans man.
Thank you for clarifying. Someone says, good to hear about the lunch next week. Have you publicized this through the San Francisco AIDS Foundation 50 Plus network?
Yeah, so the 50 Plus network is our social support group for gay, bi, and trans men over the age of 50, HIV positive and negative. Most of them are cis men, and there are a few trans folks that I will be reaching out to as well. Thank you for mentioning that.
Thank you. One more in the chat. Thank you, Jam, for this excellent report. Thank you for including such diverse community members, specifically the immigrant monolingual trans folks who often don't have a voice. Did you hear anything about their immigrant status to prevent them from getting medical or mental health services?
Yeah, we did ask a question about documentation status as, you know, an issue area. More of the monolingual Spanish-speaking trans Latino women who filled out the survey talked about this being an issue. It wasn't something that was discussed as at length in the community conversations. And we can also gauge based on like the healthcare that they're accessing. So Healthy San Francisco, which mostly serves people who aren't able to get healthcare elsewhere due to documentation status, et cetera, was ranked as a very highly utilized service among specifically our immigrant Latina trans women who completed the survey or participated in the community conversation.
Awesome, thank you so much. So
can I say something?
Yeah, go ahead.
Right. When we did this survey, it was last year, but and like Jam said, you know, mostly undocumented immigrants can access Healthy San Francisco, which is a program of San Francisco Department of Public Health. Now there's a law that regardless of your immigration status, once you turn 50, you can access full medical scope. I mean, you can access San Francisco Health Plan or any other managed medical plan. So that's a good thing for our 50 plus population in San Francisco. I guess it's in the state, the whole state, not 100% sure.
Thank you Thank you so much for sharing that. That is great. That's a great resource, San Francisco Health Plan. And I do think you did mention this. I heard you mention it, but maybe you could just repeat for this person's question. What's being done to address the issues of trans masculine community having low representation in this study?
Yeah, so we'll be undertaking listening sessions as well as community conversations with trans masculine folks over the age of 40, 50 in the upcoming year. We're currently having community meetings with different people who facilitate groups for trans masculine folks in the city, as well as across the Bay Area. And we'll be working to undertake those next steps, as well as have those community conversations in the upcoming months. Definitely, if you have any contacts or thoughts or reflections about this, feel free to contact me. I'm always happy to talk about this. If you have anyone you think I should talk to as well. And I'll put my email address in the chat as well.
Thank you so much. And I think we might also be able to share the report in the chat. So I will do that when I get a chance. But thank you so much, Jam. That was wonderful. A lot of really important information, and just really grateful for your collaboration and to share your findings with this group today. So thank you so much. Now we're going to transition to shortly to a panel discussion where we have some more community partners who will be kind of focusing our discussion around sort of what Jan mentioned with some of those recommendations and next steps, sharing some more of the services that we offer here in San Francisco and how we can continue to improve those services to be more gender affirming, and specifically for people who may be at risk of or currently experiencing dementia symptoms or cognitive decline. So we're going to get into that panel discussion shortly. First, I'm going to try to do something. It may or may not work out. I'm going to try to do a word cloud. So we have a question for you all. Since we have so many people with us, so many health providers with us today, we want to ask you, what are some of the current needs or issues you're seeing from the your LGBTQ clients or community? So I will share my screen where you can submit your responses and it will show up in a word cloud. Just give me 1 second. And then Christina, if you wouldn't mind putting that question in the chat too, that would be great. Give me 1 moment. Okay. So what are some of the current needs or issues you're seeing from your LGBTQ clients or community? Please submit them there. I'm going to launch this and see if it populates in the word cloud. Just give me 1 second. I'm going to put the link in the chat too.
Hey, Katya, this is an embarrassing question, but where do we submit our responses?
I just put a link in the chat, and then let me see if let me launch it. Launch your poll to gather responses. How do I do? There we go. It's launched. Okay.
So the link in the chat.
Yes.
Okay,
Do you want to also put the slide back up with the QR code?
Yes, let me do
People
that. I
wanna do it
had
that
to, okay, good. We're getting some responses. Okay, just give me 1 moment and I will share my screen. Loneliness, isolation, fear. We're getting some responses. And again, where you can submit this is right here. Oh, no. There we go. Please submit your responses to this question. What are some of the needs or issues you're seeing from LGBTQ clients or community members? Right here. I'll just give it a couple more moments for everyone to pull this up, and then I will pull up the results. Okay. Thought it was going to be a word cloud, but this works. Loneliness, isolation, depression, housing, fear, poverty, lack of family or friend caregiver, mental health support services, skilled transportation, through door services for disabled folks, concern for community support, not being accepting, low honor of pronouns by coworkers, language barrier in medical settings, guardians for clients who cannot consent to care due to dementia and no biological families. Thanks for mentioning that. We will be talking a little bit more about that and the benefit of advanced directives, compassionate healthcare. Well, thank you, everyone. Stigma, discrimination. Thank you so much for sharing your thoughts. And it's great to hear directly from you who are working with this community to hear what you're experiencing. And we're going to talk a little bit more about that in the panel discussion. So I'm going to hand it over to Christina Irving from Family Caregiver Alliance, who's going to be facilitating. So thank you so much.
Thanks, Katya, and thank you, Jam, so much for all of your work and the work of the others involved in the needs assessment and the report. So I'm going to invite Jam to join us for this panel, as well as our other panelists. Joanne Kipnis, who is the Program Director of the LGBTQ+ Aging and Abilities Support Network at Shanti Project. Karen Aguilar from the San Francisco Department of Public Health, the Gender Health SF Program, and Ames Simmons, Health Policy Fellow at Duke Law, among other projects and work as well. So thank you all for joining. And let me just make sure we add, oh, there we go. Okay, Ames. All right. So I'm going to open up this first question to everybody just to share a little bit more about your programs that are supporting LGBTQ+ older adults in San Francisco. So Joanne, can we start with you?
Oh, sure. I'm going first. Okay, thank you. I just want to first start out by saying what an honor and a privilege it is to be a part of this opportunity here to share, not just to share the way we support the LGBTQ community, but also just to have this collaboration around what's needed in the community and how we can all work together to do that. So thank you. I'm glad to be here to represent Shanti. Okay, so I think I have a minute or two, so I'll speak. There's a lot to share, but I can speak quickly. As a native New Yorker, that shouldn't be much of a challenge. LGBTQ Aging and Ability Support Network, otherwise known as LASAN, was formed in 2016. And that was in response to a greater awareness of the disproportionate experience of social isolation faced by many LGBTQ+ seniors and adults with disabilities, a lot of what we've been talking about all along. So to address that need, LASAN services include three major components. The first support service is care navigation. I'll talk about that. And then there's peer support volunteer. And then we have support programming, where we contract with other community partners to provide those types of services. So our care navigation approach, first of all, we have a team of 6 individuals. There's myself, the director, we have a program manager, 3 amazing care navigators, and a fabulous wellness coordinator, which is fairly new to our program and has given us the opportunity to provide in-home wellness programming, which has just been fabulous. Our 3 care navigators provide emotional support, practical support, client advocacy to assist with navigating the social and healthcare service system, and information and report services. LASAN reaches out a lot to the community to help us provide wraparound services for clients, specifically around care navigation and healthcare and housing, and all those services that we do not provide primarily through the program. A little bit about our approach to care navigation. It's based on mutual respect and positive regard. It's non-judgmental, non-directive approach. So the way we approach care navigation is we assume that our clients have pretty much a good idea or know the answers to how to solve their own problems. And our job is to empower them to do so and work together with them and follow their lead in where they want to be able to resolve a lot of the many challenges that they're facing day to day. So our approach is not to advise or to direct. It's more to be there, to be present, to show up and follow what is in the best interest of the client. Through the relationship between our care navigators, we offer companionship. So while maintaining themselves as genuine folks who show up, it's also with an empathetic nature. And our care navigators provide a great deal of time just listening. At the end of the day, it's just showing up and listening. So it's a very powerful connection built on trust and reliability. We have a fabulous peer support volunteer program. We have trained volunteers who go through an intense weekend of training. It's also the same training that our staff go through around the Shanti model of peer support. They provide emotional support, practical support. Their purpose is to strengthen the well-being and independence, offering, again, themselves as genuine, compassionate individuals and creating a trusting, compassionate connection. Our PSVs provide regular interactions with clients on a weekly basis and are based on each client's individual needs. There's a very specific, thorough matching process where we match our volunteers with our clients. The last component of our program is supportive programming, and in partnerships with Curry Senior Center and Openhouse, we're able to provide individual, emotional, and behavioral support, peer support groups, social activities, and education. And some wellness programming as well. So it's that full component of individual and behavioral support, as well as social engagement and community connection. And as I mentioned earlier, we recently started about a year ago our own in-house wellness programming, and it's really shown to be very successful. We're still piloting it. A lot of creativity, a lot of outreach to community around what they're doing, and hopefully we'll be fostering larger collaborations around our wellness programming, and really listening to what clients want with the mission of reducing isolation and engaging folks around either a specific area of interest or just getting folks together and maybe learning something new that they can participate in. And we're doing that with Zoom as well as in person. So that's been something very exciting, and we'll see where that takes us in the future, again, with a lot of collaboration in the community. Our eligibility criteria is one, you are LGBTQ identified as currently experiencing isolation and or at risk of isolation. We define seniors as 60 plus, and in terms of adults with disabilities, it's LGBTQ adults 18 plus with a disability. Thank you.
Joanne.
I hope that was helpful. Thank you.
That was, and Katya also shared a link to Shanti's programs.
Oh, great. Thank you.
Karen, can we go to you? Can you tell us a little bit about your work at Public Health and the Gender Health SF program? And Karen, you're on mute if you're talking right now.
Sorry.
No.
We are the program at San Francisco Department of Public Health who provide navigation for transgender and gender diverse patients in San Francisco County, San Francisco City. And we provide navigation for our patients to access gender affirming procedures, which can be, facial surgeries, feminization or masculinization. It can be asked by by patients who identify as female, as male, are non-binary. They can choose whatever procedure they want to access. It can be chest surgery, which is feminizing mammoplasty, or is subcutaneous mastectomy. It can be creation of vaginoplasty, phalloplasty, body contouring, voice therapy that could lead to voice surgery, and And for patients that are going for vaginoplasty or phalloplasty, we provide coverage for, San Francisco Health Plan provides coverage for hair removal, surgical hair removal, but we use San Francisco funds to provide that for for Healthy San Francisco patients that are undocumented on Healthy San Francisco. So we get assigned a patient from their primary medical care provider with what it used to be called a mental health letter, but we don't like to call it mental health letter because of the stigma that comes with it. We like to call it pre-surgical assessment, and it is not meant to assess how trans you are or how trans you're not. It is meant to assess your readiness for surgery, which is, as housing stability. And this, we're not trying to be as a gate blocker, is that how you call it? As a barrier. What we're trying to do is, to make sure you have stable housing, because we don't want someone with vaginoplasty or facial feminization or phalloplasty be couch surfing and not having the proper settings to heal from those major surgeries. So, those are plus part of the requirements to have a stable housing, to your doctor to provide readiness for surgery. And also, if patients have mental health diagnosis, as long as they've been, not been admitted for mental health crisis or whatever you want to call it, for the past 6 months, they do qualify for access to gender affirming procedures. When providers, by law, the state in California, they have to provide gender health care. But, and patients maybe could do the whole thing on their own, but this is going to be a lot. They're going to be experiencing a lot of discrimination and a lot of the stuff from bureaucracy. So when we get the referral, we do everything for them. And, we get the referral, we get their documents, we review documents, and then we refer patients to the surgeons or private surgeons or UCSF surgeons, and then navigators, which most of them identify as trans or gender non-binary patients. They will reach out to patients, introduce to them as their navigators, and then will be, the point of contact between the practices reaching out to us and navigators talking to patients, like, you need to complete this intake, you're scheduled for surgery, you're scheduled for consultation, all that stuff that patients, will be doing if gender health will not exist, like go get a pre-surgical assessment or mental health letter, take it to your doctor, and then your doctor will send it to your insurance for authorization. And once you get authorization, it will be sent to the, all of that, So we want to have our patients not have to worry about that, and then they can worry on preparing for surgery. So we can advocate for the best outcome, preparing for surgery and the best outcome. We don't stop, providing services once they get surgery. We start from when they're referred to us. We talk to their mental health providers, to primary care providers, to case managers, case workers. Sometimes, when patients, when they get ready to surgery, there's an issue with stable housing, we will reach out to providers so they can kind of work on that as soon as they can, so patients can access surgeries. And, after surgery, we provide education for preparation for aftercare. And we monitor patients for major surgeries up to 1 year of them completing their surgery. For other surgeries, it can be 6 months, but most of the time, we are like checking on them after 1 year.
Thank you so much, Karen. That's a wonderful service to have somebody who can really walk a person through that process and all the systems.
And let me just say, we were the first program in the nation to be providing these services. Thank you.
Thank you. And Jan, is there anything else you want to add about the programs at San Francisco AIDS Foundation beyond the needs assessments?
I guess just to add a little bit more about the work of my team, beyond the things I'm doing, there is 50 Plus, which is the social support group for gay, bi, trans men over the age of 50, HIV positive and negative. And then Ebony Gordon on my team has started up HUES, which is Healing and Uniting Every Sister, which is a group for Black women either living with HIV or who have reason for prevention. And that's an intergenerational group as well. And then I also just want to say that we do a lot of advocacy work as well through the HIV Advocacy Network. So we fight for and win victories in the local budget campaign around things like mental health for long-term survivors and HIV housing subsidies that do go to LGBTQ elders as well.
Thank you so much. And I'm going to turn this next question to Ames first. Jan touched on it a little bit during the report, but how can we better prepare, train, and equip health professionals to provide gender-affirming care to people, specifically when we're thinking about long-term care or memory care settings and the needs of older LGBTQ adults, especially those who might be experiencing some dementia, some cognitive impairment? So Ames, can we start with you for that one?
Yes, thank you. A lot of this, the answer that I would have are themes that you've already heard on this webinar. So I think it's important to keep in mind the context that trans people are coming from. I'm a queer, white, transgender guy who's 52 years old, but my experience walking through life is not the same as other members of the transgender community. And there's been a long history of discrimination in almost every area that creates health disparities. But it's important for providers to know that as many as almost 7 in 10 transgender people of color have had some kind of mistreatment in healthcare in their past. And that means that there are barriers of trust that have to be overcome. And the way that that might roll out in terms of long-term care is fear of further discrimination, particularly if people are more vulnerable because of dementia or because of subjective cognitive decline. I think there's beginning to be literature showing that transgender people are worried, have concerns, they fear the loss of agency and the ability to control our gender expression and gender identity in the event that cognitive decline or dementia happen. So I think that providers need to be aware of that context, and also just know that there's very little research about this so far, which is true about any aspect of healthcare for trans and non-binary people. There's not enough research literature, but what is emerging is that that there's no one way that dementia affects people's gender identity. So for some people, they might begin expressing a gender that is different from their affirmed gender. For some people, they might like go all in on their affirmed gender, and they might believe that, that maybe they have body parts that they don't actually have. So I think it's going to be really important to, address each patient or resident that is in front of you and try to figure out what is their context and what is their ability to connect. Yeah, I can say some more about well, actually, this might be a good place for me to mention the Long-Term Care Quality Index. For providers who don't know about this, SAGE and the Human Rights Campaign Foundation have just launched the Long-Term Care Quality Index, which works with residential long-term care facilities to measure LGBTQ inclusive policies. The very first survey just closed, and we expect to have a report out sometime this year. I'm on the National Advisory Council and actually getting ready to go to a meeting where we hope to learn about those numbers.
Wonderful. Thank you so much for sharing it. And we look forward to seeing that equality index. And I think that's been a long time coming. So I appreciate your work with SAGE and HRC around making that a possibility. And I also want to highlight one other thing you said that I think is a really important distinction when you mentioned those experiencing subjective cognitive decline or dementia, because we know not everyone gets diagnosed, and especially if you're not experiencing inclusive healthcare, you're not as likely to go through the process of really talking about cognitive changes and memory loss. There's all sorts of stigma around that in general, and then added to it. So that differentiation that not everyone's going to have a diagnosis and yet may be experiencing those symptoms as well. Thank you. Anything else for the other panelists that you want to add around how do we better kind of equip providers to make sure that that gender affirming care is available, particularly in long-term care settings or even in community settings? Anything else others want to add?
I just want to add for providers that, you know, hopefully they enter this career on, you know, their own willing. Nobody's like forcing them, or your father is like, you have to study this because I'm a doctor or something. But just please check your biases at the front door. You know, it's, you choose to work in this profession, and regardless of your gender identity, gender expression, or, you know, please have in mind that they're, you know, just human beings, and trans or gender not diverse people. If you touch them, you're not going to become a trans person. You know, that's not going to happen. They're not going to bite you or eat you. Well, if you want to, just kidding. So please have that in mind, you know, that you choose this profession and you choose to provide service, and you made an oath, the medicine oath or whatever, you know, so please have that in mind.
Thank you, Karen. And I'll add in kind of a plug for our LGBTQ dementia care provider trainings. Openhouse is cultural humility training. There's lots of opportunities if there are providers who feel like you're still needing a little bit more support. There's options available.
And I would say, just to add to that, there's always opportunity for ongoing training. I mean, it's a continuous opportunity to engage and learn. It's not, well, you know, this one-stop shop. And this, also based on we learn so much from our clients. We learn from them, and we learn where we need to do better, and the more trainings we need, and where we need to outreach and do more collaboration, just so we could all be, pardon the phrase, the best we could be, you know, in the best interest of our clients, and we can learn from each other. So I always think about how, as a community, we can support one another in a way that reaches to the extent we can, you know, provide that support. And then, of course, cultural competency and who you are and what you bring. And again, I love what you said. You just leave the rest at the door, because there's no room for that. There's no room. So.
And also, you know, it is great that you say, please, yes, look for training, continuous training, because even me, you know, I joined gender health like almost 7 years ago, and I come from old school, from, you know, you have to transition to pass as a woman, blah, 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 all that stuff. So, you know, I have to learn the language, like non-binary, non-conforming, and all this. And also it is great to join training. So, you know, meeting with your trans patient is not always a learning opportunity, because, you know, our community gets tired of, instead of you getting care from a provider, you have to teach your provider, what is this, what is not this, don't do this, don't do, you know. So it is great to access training. So don't, your patient experience, it's great, and not a teaching experience for a provider.
And just one other comment, I'm sorry, that's okay, is also kind of the interaction of community agencies with the medical community, in terms of just connection around how educating the medical community, as well as being LGBTQ friendly and warming and inviting. And I don't know, maybe others have other experience, but is there a better way to really make that connection and learning from one another in terms of the medical community? Because a lot of our folks don't feel very welcomed and are fearful of, you know, and as you get older, you have aging issues. And now you're in this other community of folks that are aging and seeking support, medical support and mental health support. And it's becoming very challenging.
And Jam, did you want to add anything else to this?
Yeah, I really appreciated what Aim said about like just meeting people where they're at, with like how different trans people might experience different things with their gender identity and expression in interactions with dementia, loss of memory, etc. And it makes a lot of sense. And I feel like also, to me, like affirms the importance of like advanced planning and like talking to people who might be in caregiving or decision-making positions for you, about like, yeah, your relationship with gender and how it may or may not change, and how those needs can be met even like when people may begin experiencing behaviors and symptoms of dementia, such as memory loss. Also, I did, before I was at SF AIDS Foundation, I was at a long-term care facility and spoke to LGBTQ residents there. And I think like it being their home, and like living there, like I know that there is like literature out there also about like LGBTQ people going back in the closet when they like enter this long-term care facility. And I think that also just like emphasizes the importance of like emotional safety and being able to express and like be in one's gender identity in like a residential care setting, because I think things like laughter or like jokes, and all like the subtle microaggressions can have a really big compounding impact on psychological safety and the way people may choose to show up or not show up as their whole selves, in residential care settings. And I know when I was there, Openhouse, I attended a training by Openhouse about the LGBTQ Bill of Rights for long-term care residents. And like at big facilities, like that's not necessarily, like not every staff person is aware or trained in it, nor is like every LGBTQ resident well informed about all their rights. And that is like, yeah, just the basic like rights and minimum when thinking about like how to create a truly like welcoming and embracing culture. So those are some of the things I'm thinking about in response to your question.
Right. Thank you, Jam. And I think when we look at long-term care settings in particular, but other community-based settings as well, you know, as you mentioned, kind of microaggressions and jokes or comments, I think sometimes there's a feeling of, oh, if it's someone with dementia, are they going to pick up on it? Are they going to hear it? And it's like, yeah, that doesn't go away. If anything, becomes something people are more in tune to because of the changes in communication. So if you have kind of questions for our panelists, I see one hand up, we'll come to you or put them in the chat as well. I want to circle back to one other question for the panelists, and then we'll see what other questions folks might have also. And we've kind of been touching on this already, but what kind of support can you anticipate that LGBTQ folks are going to need when it comes to memory loss and dementia, as we see the growth in our older adult population, the growth of the number of people with dementia? I'll throw it out to anyone on the panelists if there's kind of thoughts you have on what support should we be planning for, developing more. What do you see kind of coming down the road that we need to be better prepared for?
Well, I think one thing that we just started talking about is advanced care planning. And I think this is something that providers need to start early in the life course. This is not just an end of life. You need to start planning well before, especially for LGBTQ people whose support networks are probably thinner than for many people. The isolation that we've talked about on this call means that a lot of trans and non-binary people might not be able to readily identify somebody to be their healthcare agent, for example. So I think it's really important to start having those conversations, and definitely do not assume that an LGBTQ person's family member is who they would want to make decisions. There certainly are family members who are supportive of LGBTQ family members. My younger brother is great, but my best friend is completely estranged from his family, and I'm his healthcare power of attorney. And the other thing I would say about that is that it's also important to try to talk to, I think Jam had started to go in this direction about how a person understands their gender identity and what about that can be preserved or planned for in an advanced directive, whether it is treatment preferences in a living will or a healthcare power of attorney. And Transgender Law Center has a good resource that I'll put in the chat. They're right there in Oakland, and they also have a help desk people should know about.
Wonderful. Thank you, Ames. Anyone else on the panel? What supports should we need to be kind of enhancing, building out more for LGBTQ older adults with dementia, cognitive loss? Joanne?
I'll just start with the broad category and say mental health support, which I know is huge across the board, but even as it relates to dementia care and cognitive challenges, that there's this emotional component as well to that, and how to support clients emotionally and psychologically through this journey. And as far as dementia is concerned, I think there's a lot more training needed around that. And also, and we've talked about this in the network, for organizations to know where their limit is around how they can support someone, so that we can refer our clients to those more skilled, able, more, accountable to help with dementia, which I think many of us are still trying to understand what it is. And the other thing I would add is sometimes we have difficulty distinguishing between what is aging 101 as far as cognitive decline versus what might be some related dementia issue, which we know is hard to diagnose. So that was a long answer, but yeah, a lot of issues come up around mental health, but as it relates to dementia, there's a huge component there as well. A lot more accessible and low cost or no cost mental health services.
Thanks, Joanne.
Mhm.
Jam or Karen, anything you want to add to this question? We'll move on.
I don't know, what comes to my head is like, for providers, when they start seeing symptoms of dementia, if they can, I don't know, create workshops for patients to let them know, like, you might need to take care of this, and that, because of explaining the possible diagnosis. I don't know, it might sound stupid, but if trans and gender diverse patients live in assisting, housing, house cameras in the rooms, because some people could be pretending to be working with trans and gender diverse, but you don't know what they're doing when the door is closed. So have cameras, maybe, just to monitor, because you never know. I've been recovering from surgery, and the person who brought me from the recovery room to my room, they just throw the remote control where you call the nurse, and it landed in my surgical area. So I wish I could stand up and slap that person, but I was recovering from surgery, waking up from surgery. So, this might sound funny or stupid, but how to monitor providers also. I don't know.
Yeah, oh, I'm so sorry
I'm
to
very
hear that.
much
But
into the
yeah,
advocacy side.
yeah, ensuring the safety from people who maybe are supposed to be in a role of providing care. But how do we ensure that people are getting care safely? Thanks, Karen. Jam, anything you wanted to add?
I don't have too much to add, but I think something else I'm thinking about is just the role of like stigma and internalized ageism in all of this. Like Ames was talking about, advanced care planning is not something that's just end of life. It's something that like we should be talking about as like a regular part of our care needs, especially as we grow older. Especially, I feel like in LGBTQ community and TGNC community, sometimes there's an aversion to like engaging with or talking about like aging, growing old, specific language about like being a senior or an elder. I think sometimes it's like a gut instinct or a response that is not always positive, but I think thinking about ways to like engage and affirm the importance of planning and conversations around all these things while minding like stigma and internalized ageism that may be present is part of like the conversation about cultural sensitivity when talking about these kinds of care needs or anticipating these care needs.
Thank you, Jam. Yeah, all that planning and awareness and education. And I want to go to Natasha. You had your hand up. I don't know if you're still there. If you want to unmute, if you had a question you wanted to ask or share with the
I was
panel.
just typing it in, but anyway, it's, first of all, I want to say thank you for this very important summit here today. I had the opportunity to work on the first federally funded study for dementia in the LGBT community. And they're still writing up the findings, but one of the early major findings that was discovered is that LGBT people living with dementia are less likely to have a caregiver or a known person. And this is so important. We've obviously talked about it a lot today, but when we're thinking about mental health awareness and service provision and public health concern, we must keep this in mind, and our programs, all of us on the front lines must continue to advocate for programs that bring services and bring companionship and bring folks who can help people, as Karen talked about, even fill out forms or access whatever it is they need to access. It's really, really important, because at this point, the statistics are not looking in our favor. So.
Thanks, Natasha. I think that speaks to some of the importance of the care navigator type of programs, of somebody who can be there with you if there's not a kind of designated caregiver, whether that's family, friends, community.
Can I make a comment?
Yeah, Karen, go ahead.
It also will be great to invest in our community, to train and educate the trans and gender diverse community, so we can hire our own community and provide services. It will be so great to see our population be reflected in your providers, and who best to provide those type of services that also someone that is a trans and gender diverse, to invest in our communities and train them to become providers.
Absolutely. Yeah. Thank you, Karen. In our kind of last few minutes of the panel discussion, if others have questions, feel free to put them in the chat or raise your hand. But one kind of last question I want to throw out to our panelists is, and this came up, I think, a bit in Jam in your presentation as well, but for the panelists, what are strategies you would like to see implemented in the LGBTQ community and the broader community to address social isolation as we come out of the pandemic? There's been so many changes in how services delivered, what resources are available. So how do we kind of best support all the isolation that we've seen increase in the last few years? Any thoughts from panelists? Anyone who wants to jump in first? I don't know, Joanne, I mean, it sounds like you all have been starting to do that already with some of the wellness programs.
One thing that comes to mind, and this actually covers a lot of different levels, is there's such a lack of volunteers out there. When you think about reducing isolation, it just could take a phone call. It just could take, just connecting with someone. It's all about, connection. It's hard to use the term like from 0 to 1. And for some folks, it's just this initial connection. So they know I'm not gonna say connected. So they know they're in community and there are people who think about them and care about them. And I don't have the data. I know that in general, in the main, that it feels like there's a lack of trained volunteers in San Francisco. Like, I feel like we need more to work with our elders, our isolated folks. So I would say to really take a look at that and maybe have a more organized, like, volunteer hub focused on our older LGBT community especially. So that's one thing that comes to mind. Again, I can't cite any data, but I know especially now it's so needed. So that would be one potential idea.
Thanks, Joanne.
I put a link in the chat. Their Sage does have a program called Sage Connect, where they match up volunteers. It started during COVID to make like a phone buddy program. And my personal wish list is that it would expand to eventually so that there can be intergenerational matches, so that trans and non-binary folks who don't have somebody who can be their healthcare proxy or their healthcare agent, that would match them, with somebody to start building a relationship. Because so much of our care, is horizontal. It's not, we're less likely to have family members to provide that care.
Thanks, Sam. And I know Jam highlighted that came out a lot in the report as well. I don't know if there's anything else you want to add around intergenerational or kind of broader recommendations that came from the study participants.
Yeah, I think intergenerational connection is certainly something that was spoken to a lot in the needs assessment. I know in San Francisco with Openhouse, and SF Community Health Center as well. And Lyric, we do our annual intergenerational trans brunch, and have been trying to work in opportunities to like make the opportunity for connection intergenerationally more consistent throughout the year. I think sometimes, I mean, the work of community building and trust building can be slow sometimes, as well as complicated with the different like age power dynamics that can happen in different directions, you know? But I think that is something that like we hear a desire expressed for bidirectional learning and connection. Yeah, that's definitely on our radar, something we're considering in upcoming.
That's great. I think there's been such a need, and it sounds like so much of an interest on that as well. Karen?
Yes, going back to hiring trans people, I will say that I totally support about volunteers, but it will be, because the trans community suffers from employment, also from lack of employment. So it'll be great to create sort of a program that is paid volunteering and training the volunteers in a path to become providers, to become staff, and so also they can have a job that will be also sustainable for them, and then provide services and everything that comes after that.
Yes, absolutely. It kind of builds that community capacity to provide services, as well as kind of that support and that training for people to have, again, better income, better employment opportunities for themselves in their lives. Absolutely. Yes. Karen. And there's been a lot of resources shared in the chat, so please definitely take a look at those. Some of the other kind of friendly visitor or phone call support programs are listed in there. I know Ames has added the Sage Connect program. Natasha added the Aging with Pride study. So lots of resources in the chat for everyone to take a look at as well. I want to give us a few minutes to wrap up and share, which I know has also been in the chat, about some upcoming trainings. But as we wrap up with our panelists, I just want to say thank you so much for sharing your time and your expertise with our group today. I think this has been such a rich conversation, and there's obviously so much more work to be done. And yet it's great hearing about programs and services that do exist, and to make sure that as providers, we all know about them so that we can connect our clients with what's available. I will also add, for those who are in San Francisco on the call, and I know we've got a few people from other areas, the Bay Area, if there are programs or services that you feel like are lacking, there are opportunities for advocacy around increasing funding and increasing services through CASE, the Coalition of Agencies Serving the Elderly, and the Dignity Fund Coalition. So opportunities to say, here's where there are gaps, here's where we need more services, more supports. So when I finish up talking, because I can't multitask, I'll add those into the chat. So if people do want to participate in some of those advocacy groups and kind of bring forward where you're seeing other needs that aren't being well served within the community, that would be a wonderful addition. But thank you so much to our panelists. I so appreciate your time today. And I'm going to turn it back over to Katya for our wrap up and closing and sharing additional information about upcoming trainings.
Thank you all so much. And thank you, Christina. Yeah, I just want to, I shared this a bit at the beginning, but I just want to share my screen to show how you can get in touch with the community partners that work on the San Francisco LGBTQ Dementia Care Project for to schedule any upcoming trainings or to learn more about them. So let me share my screen really quickly, and we might end a little early today, give you 5 minutes of your time back. But here's where you can schedule a training or express interest or learn more about what we offer. We have LGBTQ cultural humility trainings for any health provider serving older adults or LGBTQ people in San Francisco. We also have an effective communication strategies, dementia care better practices training. And we can do anywhere from 1 hour to 3 hour trainings available in English, Cantonese, Spanish, and Mandarin. That's not listed there, but we have trainings available if you have any monolingual staff. And here is how you can get in contact with all of us, Openhouse, Family Caregiver Alliance, and the Alzheimer's Association. And I believe Ephraim shared a flyer for some upcoming open trainings instead of doing a closed training. If you prefer to just join one of those, we have a training upcoming on March 14th and March 21st, I believe. So Ephraim, if you would just put that flyer in the chat again, that would be great. And that's it from me. So thank you all again so much for your time. Thank you for joining. If you have any additional questions, please feel free to follow up. And thanks again to all of our awesome panelists for that rich discussion. Thank you so much, everyone. All right, thank you. Have a great day. Take care.